30 years is a long time in healthcare. Technology changes, expectations rise, and patients change. What doesn't change is the disciplines of constantly reimagining what excellence should look like. Today, I'm joined by Amer Salha, Chef Facility Planning and Expectation, to explore how American Hospital Dubai designs the future through technology, planning, and intentional patient experience. Assalamu alaikum, Dr.
Wa alaikum assalam wa rahmatullahi wa barakatuh. It's an honor.
Yes. What is the single belief that has guided every expansion, upgrade, and investment decision at American Hospital Dubai over the past 30 years?
That's a very good question. And the answer is the board of directors and the governance of American Hospital Dubai felt the need to bring in quality healthcare that matches or even exceeds ones that are in America. They were traveling to Cleveland Clinic, to Mayo Clinic, and Mass General Hospital for diagnosis and treatment. And they felt that they owe it to the people of UAE to bring in such quality with compliance, because we were the first healthcare facility to gain and earn Joint Commission International Accreditation. So we wanted not only to do it, but we wanted to do it with quality. We wanted to do it with clinical services. We were the first to bring in the bilateral knees and hip surgery, cochlear implant, beating heart surgery. We wanted to bring value to the people of Dubai and United Arab Emirates. So we did it. We did it step by step. And as we were told, quality is a journey, non-stopping.
Yes, of course.
We knew that we had to evolve and we have to execute projects and learn from our shortcomings, enhance it as we go. There are some facilities that we established back in 1996 that got refurbished and look even better and repurposed with a completely different purpose. It tells us that the people of UAE deserve nothing but the best.
Yeah, yes, for sure. Mr. Amer, you're often describe excellence as an evolving discipline rather than a destination. How does that mindset shape long-term healthcare planning?
It's my belief, and it's the belief of the board of directors as well, and each and every one of us. It's a culture at the American Hospital Dubai, and the culture is scrutinize the system, check, see if it's made, how to make it better. Listen to your customers. Look from the back and get a bird's eye view. Be a mystery shopper. Look at what is existing and how to make it better. Even in terms of healthcare, we were the first one to look into acquiring a robotic surgical system. We believe that it will provide us with less complication, better outcome, less in-hospital stay, and less infection rates. We believe that getting into artificial intelligence very early on, as early as 2017, when people were talking about large database, we had invested in a couple of software packages that has to do with artificial intelligence, which helps the doctor identify lesion, which circles them, marker classification. The doctor can say yes or no. Ultimately, it's a doctor's decision. But we always believed that the patient comes first, and the patient has to be diagnosed with perfect precision, treated along a professional clinical path, and discharged as soon as possible to be with their loved ones. And that's the journey, and that's an endless journey, and it has no look in the future horizon, which means if you stop and say, this is my target, you failed. you become another Nokia model and a Kodak model.
But it's a very powerful thing that you said, keeping the patient first. So anything, any change or any plan or any decision, putting the patients first is always will make difference, definitely.
Absolutely.
What does an intentionally designed patient experience truly mean from the patient's perspective? We said patients first, right? So what does that mean from the patient's perspective? Not just in buildings, but in how care is felt.
Amazing, because if I'm a patient, and I am a patient of the American Hospital Dubai, as a matter of fact, I have done 2 major surgeries at the American Hospital Dubai. And as a patient, you said it right. I mean, from the first point, which is, we call it circulation. I don't want bottlenecks when I drive my car in. I have to make my appointment. I have a set time to get there. So our in-hospital circulation is very well managed by security staff and facility management staff. Our parking lots designed, and you can challenge me, you can go and visit yourself, designed for large SUVs. So when you get in there and you have a knee pain or leg pain, you have to open the door fully. You can do that. Our signage is perfect. Our appointments, our call center, they follow up with you a day before as a reminder. Sir, you have H. pylori test tomorrow. Yes, sir. Yes. Please, you confirm? Yes. You have to fast 4 hours ahead. Yes. Then you make it there. The ambience, the facility, again, you said it's not just the facility, but the ambience and the facility, it helps. The people smiling, it helps. We were taught as a culture again. We were involved in a program called STOCK program, which is delight our customers. And what that entails or means is, when a patient asks me, where is physiotherapy? I'm not going to tell him, go straight, take a right, and a left, and a second left, and then you're there. No. I'm going to walk with that patient until I get him to physiotherapy, greet the receptionist and tell him, Mr. Sultan is here for an appointment. This is delight our customers. Once he's there, he'll feel the difference. He's received, he's welcomed, his appointment is confirmed, he's seated, and then there is no lag between his appointment and the time the doctor sees him, because guess what? We have a very well managed patient schedule with the doctors, because our doctors are given 20-minute slots and 40-minute slots. It depends if it's a first visit or a return, yes ma'am, or for a follow-up. Having said that, let's say that the patient needs an ultrasound or a CT scan. We have taken the ultrasounds to the ward, to the clinic, in each clinic cluster. We take it to you, not send you to it. And then the results is, as we all know, it's about PACS. So it means got scanned, within seconds I have it right on my workstation. Then the pharmacy is there. We have a beautiful queuing system where you just take a ticket, mobile number, seat, go get coffee. And then you'll be flagged and flashed that your number had come up. Whether you're a cash payer or insurance coverage, you get your medicine. Then if there's a follow-up appointment, our call center will call you and make that follow-up appointment and follow up with you. If there is a patient complaint, you put in that complaint, and our quality department will contact you and make sure that you're happy and get exactly that issue that you have resolved. And this is the American hospital that I know as a patient.
You took us to a journey from the patient actually not stepping in the hospital, actually from the parking. So you thought for every single step throughout this journey, and you made sure that the patient is comfortable throughout till he leaves. So it's an excellent approach to really patient first. With AI, data and robotic advancing rapidly, as we see, every day is new things. How do you distinguish between meaningful innovation and passing trends?
Well, being the nerd of the American Hospital Dubai and the go-to guy to sort through which AI do we invest in or evaluate and which one we don't, now it has transformed to a very professional committee involving all discipline, doctors, IT, operation, a complex bouquet of physicians
Yeah.
in all the disciplines. So whatever I would put in a table, it gets evaluated by a committee. And historically, and as I said, it started back in 2016, 2017. Historically, when we believe in an AI solution, we would bring in and then we would evaluate it. This meaning that we have evaluated AI solutions for breast cancer. We have evaluated AI solutions for general cancer detection for PET-CT. We have done it for many applications, including neuronavigation pre-planning. And now we're even doing it more professionally by exploring the AI solutions surgically, robotically, because with the robotic system, you can sit comfortably as a physician, and then you don't have to be at the surgical site. You don't have to sit at the patient's abdomen
Yeah.
and lean forward and get exhausted if the surgery is 2 to 3 or 4 hours.
Yeah.
You sit comfortably at the station, and then you can magnify the surgical site. You can zoom in. When you apply excessive pressure, the Da Vinci system acknowledges that and only corrects what the applied pressure should be. When you apply a coagulation factor, the same thing, it prevents the charring effect. Your arms can rotate maximum, I'm talking about myself, 70 degrees in each direction. The robo can go 360 degrees
Yeah.
with no complication. Plus, the best thing about it is two surgeons can perform the same appendectomy, Surgeon X and Surgeon Y, and the system would say Surgeon X did the surgery with 120 moves. Surgeon Y needs training because he did it with 170 moves. Now that's AI.
Yeah.
And that forces us to say, excuse me, Surgeon Y, we need to send you back to the academy
I know.
and we need to work on your stitching
Yeah.
and suturing.
That's advancing, really. يعني this is will make our healthcare system more powerful and the patient care even better and better. So I have a question a little bit related to what you said. Is the highest form of healthcare technology when patients barely notice it, yet benefit from it at every step?
As a matter of fact, patients are getting more and more aware.
Yes.
We have patients who come in who had visited ChatGPT, DeepSeek, and Google
diagnosed
AI,
themselves.
and then had come up with us and saying, I think I have this. And we had patients who the first question is, I know what I need, but do you have robotic surgery? And the answer is yes, because the patients are now doing their homework and they know that with what advances and what advantages clinically from hospital stay, from complication, from infection control, what would they gain if it's done robotically versus if it's done conventionally, which is laparoscopically.
Yeah.
Honestly speaking, I was a mechanic when I was 20 years old, not because that's my profession, but because I love mechanics. I like to work on my cars.
Yeah.
And changing my alternator or the battery charging mechanism, which is deep in the engine, it took me some time. The longer it took, the more my back and my shoulder aches, the more it affects my torque on my nuts and screws.
Yeah.
The worse my outcome as a mechanical task becomes.
Yeah.
That's exactly the same with physicians. If you do it laparoscopically, your first 1 hour is better than your second hour, is better than your final stitches, which is not good for the patient outcome. Versus when you have a Da Vinci 5 system, which adjusts to the doctor's neck, head, vision, and gives him the optimum position while he's doing the surgery. That means his first hour and his last hour is almost the same.
The same, yeah. Excellent. So what criteria matter most when selecting global partners to integrate into the American Hospital Dubai's clinical and operational ecosystem?
With the evolution in technology, where you have credible Chinese healthcare providers and Korean manufacturers being on the table, we still mandate that the systems and innovations that we invest in and partner with is FDA approved, CE marked, UL compliant, and has the reputation of reliability and after-market sales support. After all, you don't want to provide MRI services with motion correction today and then apologize for the market for the next month because your modality is down. Yeah, modalities can go down, you can have a fault, but with partners like Siemens and GE and Canon, they have spares of stock, they have trained engineers, and they have professional application specialists who can make you utilize the machine to the best and the most to the benefit of your patients. There are software packages on each and every modalities that really serves great for the patient. In MRI, there is something called spectroscopy package, which is really provides a great advances in terms of diagnostic in MRI. There is color contrast programs and softwares that if our technicians in imaging modalities are trained, these packages are utilized and you have better views and better diagnostic tools to use and give an answer to your patient.
So in your opinion, how do research, innovation, and evidence-based care work together to protect patients from both outdated practices, unfortunately, and untested ideas?
Research, innovation. I have to take us back to one clinical discipline for us to compare the before and after, because if I don't, then it'll be a liquefied answer. And I can take, for example, the appendix. You come in with an abdominal pain. Before we had an ultrasound, you have to play the guessing game. And even when we brought in an ultrasound and we did our blood test and we identified that you have an inflamed appendix, we used to cut the patient completely, the abdomen, to extract the appendix.
Exactly.
That evolved, and now we start doing it laparoscopically. And then from there onwards, we say, why? We can enhance that further and do it robotically. The same I can mention for a spinal fusion. Early on, for spinal fusion, the best is to use a C-arm. You put the patient on a table, you acquire an axial lateral scan, and then you try with a finger to put your finger on the pedicle and identify where the pedicle is, and you do your best to put in the nails to fuse the vertebra or to multiple levels. And then if the doctor did not do a very precise job, or if you have a slight motion because of driving the pedicle screws, guess what? The outcome is compromised, and you have one side of the screw is sitting thinner in terms of bone orientation from the other side. That evolved with neuronavigation systems, more technological advances, where you can do pre-planning a day before, and you can do pre-planning on a structure. And then you say, this is where I'm gonna enter, this is the cranium I'm gonna take off, this avoids vascularization in the brain, And then you have an O-arm, which gives you a 3D scan. And then when you place in your screws, because of navigation, you see the length of the screw and the outer diameter of the screw and the angulation of the insertion. It becomes a perfect mirror image, zero complication. And when you discharge that patient, you can clap for yourself before you even sign that discharge paper. This is technology, and this is what it does to our patients. And this is the confidence it gives our patients, and it transforms back to the patients and his family.
Excellent. So, looking back, what part of the American Hospital Dubai's evolution makes you most proud of? Not as a leader, but as someone responsible for the spaces where lives are cared for.
That's a tough question, and you can find me with time, but I will just nail it right on, and I will say from our milestones what we were able to achieve as American Hospital Dubai. The first beating heart surgery, the first bilateral knees and hips, the first cochlear implant with speech therapy, the first PET-CT in Dubai and Northern Emirates, the first linear accelerator for cancer therapy, the first electrophysiology center with bilateral cath lab, biplane cath lab, the first Da Vinci XI system, the first bone marrow transplant center. I have to say, I am a proud member of this dynasty that constantly challenges itself, constantly corrects its path, constantly strives for excellence and perfection, and sees quality as an endless journey and not a destination.
Mr. Amer, thank you so much for sharing not just how hospitals are built, but why they are built for and why they are built the way they are. You took us through a journey how American Hospital Dubai's started and how the future will look like, because there's constant
evolution.
Yes, evolution. These conversations remind us that true medical excellence is not about machines or buildings. It is about intention and the courage to keep evolving. Thank you so much.
Thank you. Thank you for having me. It's an honor.
Yeah, it is my
you.
honor. Thank you so much.
Appreciate it.